Welcome to the Dental Reset. I'm Dr. Arash Hakhamian, the modern dentist. This show is a show that we are putting on to really highlight the incredible changes that are not only going on in dentistry, but really a microcosm of what's going on in the world. The world is going through a reset from financial systems to politics, and dentistry is no exception. And really, what we want to do is highlight some of the game changers, the innovators, some of the most disruptive things that are happening in our profession, and interview the CEOs, the trendsetters who are making these disruptions. And really, as someone who's been involved in dentistry for all my life, practically born in a dental office, mom, dad, brother, sister, everyone's been involved in dentistry, and I've gone through different aspects of dentistry, from owning my own offices to teaching, volunteering, working with organizations like the American Dental Association, the Special Olympics, NGOs, and now working with insurance carriers and the technology side. I've just been exposed to so many incredible people, and these are some of the insights, the back behind the scenes that we wouldn't see as clinical dentists working day to day in our offices, and really just want to bring this incredible information so that not only do we as dental professionals and as patients get to see what dentistry really is all about, but where it's going, where the future of dentistry is heading, and who are these incredible people that are driving these changes. And we're starting out with a bang. Today, my guest, Dr. Emily Stein, is probably going to be one of the most well-known and well-recognized names. That's not just changing dentistry, but probably changing the world as we know it. So we thought we were going to start with a banger today. Dr. Emily Stein, thank you so much for joining me, and I cannot wait to share more about what you're doing and really how this is, I think, going to change dentistry as we know it. So welcome.
Great to be here. Thank you.
Yeah, thank you. I had the pleasure of meeting you actually through Delta Dental, who is obviously, we all know Delta Dental is a major insurance carrier. And when I got that phone call, they said, you need to come to Minnesota, and we have a secret to tell you. We have someone we want you to meet. I was very intrigued. I said, it's not every day you get a phone call inviting you to come out, and no one would share any information about what's going on. And it was so hush-hush, so it intrigued me even more. So, flew out to Minnesota and had a chance to meet you after signing tons of NDAs and all the paperwork. But I was absolutely just mesmerized at what you're doing, the companies and entities you're working with, and really what type of profound impact this is going to have on dentistry. Now, just to kind of give some people the reference and some framework about who you are, tell us a little bit about yourself, your history, and how you got to this incredible position you're in.
Yeah. So I'm a total nerd, microbiologist. My doctorate was in micro at University of California, Berkeley. I fell in love with bacteria a couple of years before that, even in undergrad at the University of Iowa. And you know how you just land in a subject matter that just makes sense? You don't even have to study. That was kind of me. I aced basic micro as pre-med, and it's just like, this totally makes sense. And I got to work in a BSL-3, which is a like something that can kill you. You have to they grade them based on 1, 2, 3, and 4 being the worst, like Ebola. I was in a 3. So on Fridays, everybody would be going to the bars and whatever. I was in a BSL-3 playing with multi-drug resistant tuberculosis for fun. And that was just kind of what I fell in love with, and I pursued that passion to Berkeley, spent 6 years studying how microbes work together in a social matrix called a biofilm in a community, how they resist things like radiation, ozone, antibiotics, antiseptics. And then I kind of changed gears a little bit to focus on an area that I'm passionate about, which is autoimmune disease and chronic inflammatory diseases. My grandmother had rheumatoid arthritis, and so I spent 7 years there at Stanford studying in School of Medicine, studying rheum, mainly focused on like rheumatoid arthritis. I did a little lupus and MS work.
Wow. Wow, that's incredible. Yeah, this is obviously a very niche area to study, and your experience in this is probably how many people you think are there in the world that have this type of experience in what you do?
Yeah, so not as many as you'd think. So I understand it from the angle of the microbe living in a host and how it manipulates its host to survive. I also understand it from the perspective of the immune system and how the immune system thinks, but I also focus a lot on the neuroendocrine system and that axis in inflammatory disease states. So it seems to be all these 4 different forces that kind of come together that can either keep you healthy or cause massive problems.
And from what I understand, I'm not sure if we're publicly allowed to share this, but I'm going to do it anyway. You work with like in NASA, with the European
Yeah.
Space Agency,
Yeah.
with really just forward-thinking institutions that are probably 7-10 years ahead of the rest of the world
Yeah.
as far as technology.
I mean, they want to have a colony on Mars. So it's planning that out, and what does that look like?
And so you've set your eyes on dentistry.
Mhm.
Yeah, I think just when I heard what you're doing, I said, we have all been waiting for this for as long as I can remember. I mean, things like curing cavities, vaccines for cavities, vaccines for gum disease.
Mhm.
And what you're working on is not a vaccine. We all thought it's going to be a vaccine, but apparently you found a different way to approach it. And this, when I heard this, I said, she's going to put all of us out of business. She's literally, she's going to kill dentistry, but I'm glad to hear that that's not the case. But yeah, when I heard that we can now potentially work towards eradicating cavities, this is something that I think we should all know about. The problem, I think, in dentistry is that we don't get to hear about these things until 10 years later.
Mm.
And actually, you've been working on this. How long have you been working on this?
13.
13 years, right. And we're just touching the tip of the iceberg. Most people still haven't even heard that this technology exists. Outside of companies like Delta Dental, Abova, NASA, I'm sure they've all heard about this, but the average dentist doesn't know what's coming.
Mm-mm.
Yeah.
Not yet.
Yeah, so let's go back and let's break it down for the audience, because our audience is not only dental professionals but medical professionals and then the general public. So let's talk about bugs, bacteria, right? Because we hate bacteria, right? Like, bacteria are bad. We want to kill them. Antibiotics kills bacteria. We love antibiotics. Like, give us a little background on bugs.
Yeah. So bugs, basically humans are made up of 90% of us is bug, 10% is human, and we would not exist without them. As a microbiologist, they're carrying on foundational metabolic processes. They keep our immune system healthy. They keep our gut and our mouth healthy. They help regulate the neuronal function in your brain and your moods. They're basically like our puppeteers, and we're the puppets. And, we're finding now that we hear about gut health all the time, but what a lot of folks don't recognize is that the mouth is the origin for a lot of systemic diseases. And I've chased, since my grandmother had a stroke from a tooth extraction, that's what got me into the dental field. And I've been chasing the upstream source of the problem since, over the last 13 years.
So the mouth being the biggest orifice in the body, like, this is the entry point for bad bacteria and for things to get into our systems. And you're saying that a lot of the systemic issues, like, what are we talking about? Are we talking about diabetes? Are we talking about cancer? Are we talking about Alzheimer's? What specifically are we talking about?
Many cardiovascular diseases, type 2 diabetes, type 3 diabetes. Most people don't know what that is. Pancreatic cancer, lower gut inflammatory disorders like ulcerative colitis, Crohn's, IBD, colon cancer, COPD, fibrosis of the lung, Alzheimer's, dementia, and some liver diseases. And where I come from, joint diseases are indirectly linked to who's living in the mouth.
That's insane.
Yeah, it's scary as heck.
That's insane. So outside of the gut, I think I've heard you say that the mouth, the oral cavity, has one of the most diverse and abundant microbiomes, right?
Correct. The second.
Second largest. So how
Mhm.
many bacteria do we have in our mouth? Like,
Oh,
what are we
it's
talking about?
every time you swallow, you're swallowing over 1 million microbes.
Oh, that's nice.
Yeah. Yeah.
That's
They're
great.
everywhere.
We're not just talking about bacteria, right?
No.
We have
Viruses, fungus, protozoa, archaea. No one talks about archaea. It's a whole domain.
Candida.
Yeah. Great stuff.
But we have good stuff too, right?
Oh,
You're saying
yeah.
it's not all bad.
No. Yeah, there's a lot of really good microbes that we really need to put our arms around and encourage their growth for the well-being of our own selves.
So I've heard of this concept called leaky gut syndrome, right? So basically, some of the foods we eat, some of the stuff that we digest, instead of going through the digestive tract, it leaks into the blood and ends up in places it shouldn't, right? The food shouldn't end up directly into your blood system. But from what I'm hearing is we have this concept now called leaky gum syndrome or leaky mouth syndrome, where some of these bacteria, we have vasculature, we have arteries and veins. So some of this stuff goes directly into the bloodstream and then gets carried to the rest of the body. Is that how it works?
That's one of the ways. Lymph system's another way. And the neuronal system is an area I'm interested in because I think they're zipping around. COVID showed us quite well that these viruses can zip around. And we know from herpes that that's one of the main highway systems that they use to move from the spinal cord to your lips or genitalia if you have that kind of herpes.
Oh, wow.
Yeah, they're zipping around in different highway systems throughout our body, and that's how they move and translocate. And so leaky gut and leaky gums are a significant breach in our barrier of the mucosal epithelium, which is built to protect us. Literally what's in our mouth and in our gut is outside of our body. And the mucosa, which is your gum tissue and your intestinal lining, that's the barrier to the outside world, technically.
So even though it's in our mouth, it's still technically on the outer portion. It hasn't penetrated the inner highways, the inner network.
Correct. Okay. But the problem is when we're super stressed or we're eating an unhealthy diet or we're getting hit with antiseptics or antibiotics, we get loose. It gets loose. And if some microbes are inhabiting us, they intentionally make it loose for their own benefit.
So can I think of the highway, all these highways in our body like a freeway, and then we're talking about on-ramps. We're talking about how to get into this, and that is the neuronal system, veins, arteries.
Yeah.
Okay.
They're basically like constantly wanting to look for new nutrient sources, and we're a walking nutrient source for them, right? So that's why a lot of people, sorry, I personify microbes. That's why a lot of these microbes live in our mouth. It's a great environment. They get fed all the time. And then in the GI tract, they get even more processed food that they can eat. But that's not often enough. Like, for instance, Porphyromonas gingivalis needs heme in order to survive. So it constantly creates these little nicks in our gum tissue and in blood vessels, so it can steal our heme off of
our blood.
Yeah,
okay.
It needs blood to survive.
So what do we always say? I remember growing up, my mom used to say, "You are what you eat."
Totally.
Right? Mm-hmm. So I saw on the cover of Harvard Magazine just recently, it said, "You are what your microbes eat."
100%.
Or what is it? It said, "You are what you feed your microbes."
Yeah, because you eat their waste products.
That's crazy.
You didn't eat that cheeseburger. Your microbes ate that cheeseburger, and then they secreted all that waste product that you then digested.
So when I get a craving for something, is it maybe the microbes craving it? Is that how that works?
Yeah. So there's been some studies now. So anecdotally, there's a lot of evidence to show that women tend to crave sugar before they have a yeast infection.
Yeah. That's insane. So let's step back a little bit. So not all bacteria are bad. I want to talk about your technology a little bit, just to give a reference. So you are figuring out, or you have figured out, how to control the bacteria instead of just eradicating good, bad, just killing everything off, which is not good. Right?
And it doesn't work.
It doesn't work.
No, it doesn't work.
There's resistance. We rely on some of these bacteria to actually help us, right?
Absolutely.
So instead of trying to kill them, right, we just control them?
Yeah, we're controlling them through the language that they speak. So microbes, if you give them a molecular sledgehammer, which is a lot of these antiseptics or antibiotics that we're brushing our teeth with or gargling with, the microbes literally design around it and become resistant to it. And so you didn't really help the situation. You just took the burden down a little bit, but they grow right back.
You made it worse, essentially. You're making them stronger almost.
You're making them stronger. And if it's harsh enough to kill microbes in a lab, it's going to really hurt your own tissue. And so you need to think about DNA damage and things like that when you think about using a lot of products on the market. And so what we've been doing is just approaching it from a completely different angle and speaking the language that microbes speak, which is food. And so we are literally blocking globally in the mouth sugar uptake from fungus, bacteria, and your mammalian cells. And then we're stimulating a go signal to have the microbes instead start to break down an alternative carbon source known as protein. And so we're basically putting the microbiome on a little keto diet.
Keto diet. That's what I was going to say. Yeah.
But the outcome of that is actually super cool because in people with gum disease, like my grandmother had, folks tend to have less molecules. I'm going to whip out some chemistry here. So brush off your chem book. But nitrate, nitrite, nitric oxide, and ammonium are actually good byproducts that good beneficial microbes make below the gum line. If you wipe them out or they become overtaken by these gum disease pathogens, those levels of those beneficial waste products go way, way down. And we know that that correlates really strongly with disease.
And blood pressure.
Blood pressure.
Right.
Yeah.
Right.
It's involved in all sorts of things.
So I heard about this, that that mouthwash, one of these incredible dentists that I follow, was mentioning about how your mouthwash can kill you, and I was like,
oh, totally.
How's your mouthwash going to kill you? But killing all of these good bacteria, and decreasing the nitrates or nitrites can actually elevate your blood pressure enough to actually kill you. Who the heck would have ever thought that your mouthwash can increase your blood pressure? It's nuts.
And it's linked to head and neck cancer. I mean, anything that's harsh enough that was first originated as let's be honest, a floor cleanser. A lot of these antiseptics were previously discovered and used as antiseptic cleansing agents in hospitals, right? And they've been repurposed to put in toothpaste and mouthwash. And so that has an effect on our DNA. Foundationally, and it really upsets the innate immune system, and so you start getting inflammation. And more frequent you use these products, the more frequent the inflammation gets. So you wind up with a low-grade chronic inflammation, which is also linked to cancer, and it's just not good.
So cancer is on the rise.
Cancer is.
Alzheimer's on the rise. Dementia's on the rise. Like all the bad stuff. For some reason now, I would have thought they're decreasing, but they're all increasing.
And the number of microbes that love that ecosystem of stress, high cortisol levels, high CRP, which is C-reactive protein, leaky gums, that's just a breeding ground for these pathogens to fester and cause additional problems.
Yeah. So you heard it here, folks. Not all bacteria are bad for you. We depend on good bacteria.
We do.
We don't want to kill them. No. We want to control them.
Yeah. Okay. Yeah. The best way to do that is a nutritional carrot and a nutritional stick.
Okay.
And do it at the same time and get them to behave.
So it's like my trainer was saying, look, we want to get you fit. We want to get you to reach your goal, but 90% is going to be diet, 10% is going to be exercise. No matter what we do here in the gym, it's all going to be based on your diet. So essentially what you're saying is 90% of your oral health
basically
is based on what you or how you are manipulating the microbes and how they're eating is essentially what I'm hearing.
You are what you eat. And it's foundationally true. Yeah. And you can steer off and avoid getting cavities and avoid getting gum disease for the most part through your diet.
So And through the diet of the microbes that are causing.
That's the foundation. It's
Yeah,
not really,
yeah.
you're never eating. It's the microbes
It's the
that are
microbes
eating
that are
first.
eating. Oh, that's good. So let's talk about inflammation.
Mm.
Because it seems to be like the common denominator in a lot of these issues is inflammation in your arteries, inflammation in your joints, inflammation causing gum disease, which then breaks down the bone. It's the inflammation that's really breaking down, right? It's your body's reaction. So tell me a little bit about inflammation. And I've heard you say that a lot of these issues are actually autoimmune.
Yeah.
Talk to me. I've never heard about gum disease being an autoimmune disorder.
It's got a lot of the hallmarks of an autoimmune disease.
Okay.
In rheumatology, we know that if patients have rheumatoid arthritis, very likely that they will develop periodontal disease and vice versa.
Okay.
If you have gum disease, your rates of increased risk to develop an autoimmune disease are way higher than the average population. I mean, it's kind of scary how related it is. So gum disease originally starts off as like gingivitis, and it's like a polymicrobial infection. So it's not just one microbe causing it, which is why vaccines aren't going to work, right? And that usually causes this recruitment of the immune system. You got the innate immune system going at it, so trying to put down the infection. And then you have the adaptive immune system that starts to come in and make antibodies against your own microbes or the microbes that are causing problems. T cells, memory B cells, things like that. And it's all going on underneath your gum tissue silently. And you're not knowing this is happening. And then over time, you start to develop antibodies against your own tissue. And you got the microbes there that are also modifying the environment. So they're modifying your tissue. Then you have your immune system hitting your tissue. And you've got it's like a triple hit almost. And if you have a bad diet, that's going to facilitate even more of an exacerbated inflammatory effect and continue to feed the wrong kind of microbes. And then you don't have enough of the good guys there to keep the immune system quiet and help self-regulate barrier function.
So how much does genetics have to do with this? Like, I've got a lot of patients throughout the year saying, my mom has bad teeth, or this is, I got this from my parents and it's just genetic. And so I think there is a genetic component, but what I've also learned recently, which is another just paradigm shift for me, is how your parents in your early years set, really the microbiome that you're stuck with pretty much for the rest of your life, unless, you're modifying things. And so I want to talk about that. Let's talk about genetics. Sure. How much does your genetics, how much of this is out of your control?
Well, yeah, that's the $1 million question. We know genetics do play a role, but we're finding that the microbiome that you inherited when you were born actually is as significant, if not more significant. So you're born, you're setting up your own microbiome. You inherit, if you're vaginally birthed, you inherited your mom's microbiome. If you were C-section, you inherited the hospital room's microbiome.
Nice.
Yeah, I know. And then you obviously get taken home, and whether or not you're formula fed or breastfed, that does influence the biome.
Okay.
And then usually around between ages of 2 and 3, your inherent microbiome fixes.
It's a set.
It kind of sets itself.
So let's break this down a little further.
Basically, when you start to get teeth,
so
like all your
microbiome is the environment, and we have different microbiomes. We have the oral microbiome, we have the vaginal microbiome, skin microbiome, gut microbiome. This is basically the environment, the world of all the different bacteria, good, bad, viruses, all the microbes. Is that correct?
Correct.
Is that accurate? Okay. And you're saying that has a profound impact on your health. Your microbiome basically, in a large way, determines your health.
It plays a significant role because remember, that is like 90% of your metabolic capability is microbial, right? So yes, we have mitochondria, but that's about 10% of the equation. 90% is your microbiome.
And you're saying that basically is set at birth until about 2 to 3 years. that's when that environment forms, and it really essentially doesn't really change
Yeah,
much.
yeah. After about 3, all the metadata show that people tend to just, or kids just tend to have that fixed. But the environment that you are in, you kind of wear your environment too. So layered on top of that is the microbiome of your home, right?
Mm.
And your other family members and how that can influence them.
Who you kiss.
Who you kiss. The millions of microbes you exchange in a single kiss. Yeah. That's why you can get a sore throat dating someone new.
Dating someone new. Okay. So just don't have random makeout sessions with people you don't know.
You know, it's funny. I learned that in undergrad. And then I came home.
My professional advice.
I know. I learned that like on a Friday, and I came home and I was hanging. I had a lot of roommates, and we lived in one house, and my roommate was like complaining of a sore throat. I'm like, "Are you dating someone new?" And she's like, "Well, yes, I am." I'm like, "I know what you did last week."
Nice.
Yeah.
So are you saying that basically people in the same household will tend to share similar disease patterns?
Yeah, you can actually. So we're finding through like fecal transplant, even, so that's where you wipe out your own gut microbiome and then you transfer in someone else's, right? You can inherit
That's disgusting.
their disease state.
Wait, is that a thing? You take bacteria from someone's fecal matter and transplant it?
Yeah, gastric, right up the nose,
You
down
take it
the
from
throat.
fecal to
Poop.
oral?
They're working on that right now.
that's
Oral
nice.
to oral, and then
Oh,
fecal to fecal. But but what we know is that if you wind up with what's called dysbiosis, where you don't have enough good, too many harmful microbes in the mouth, say, you're going to develop dysbiosis in the gut, lower GI, and vice versa. So if you have lower gut issues, you're going to wind up with oral dysbiosis.
So sometime in the near future, someone can go to their dentist and have fecal bacteria transplanted into their mouth.
I wouldn't say fecal. I would say healthy oral microbiome transplanted into the mouth. Yeah, but it doesn't last.
Okay.
It doesn't last because you have your own seed.
So this
microbiome.
whole thing about you take antibiotics and it just kills everything, and now we have to take all these probiotics to repopulate it with good bacteria, because like that's a multi-billion-dollar market.
Huge.
So what you're saying is that if you do have antibiotics as an adult and it completely does kill all the good and the bad, somehow that information is still stored somewhere and it comes back and repopulates over time?
Yeah, so what we found out is that antibiotics don't really kill your own microbiome. They just take it down a notch in the number of microbes there. But they can't get rid of the reservoir. We still don't know where that freaking reservoir is in the body. I don't know.
It's hidden somewhere.
It's hidden somewhere. We don't know where it is yet. But yeah, if you hit your biome with an antibiotic, it'll have some kind of bias, either gram negative or gram positive. But what we see over time is that it'll repopulate itself.
Even if you don't take probiotics?
No, just have some fermented, like, I don't know, yogurt or something like that. Gives you the same benefit.
But even if you don't, like, it's going to just over time come back.
Yeah, when I take an antibiotic for an infection, I don't do probiotics.
So it's the first 3 years that are the most important. They
for
determine
setting it up
the rest of your life. So if if you're cavity prone, blame your grandma or your mother. That's what I'm hearing. Or whoever kissed you at because babies, the first thing people do is they kiss the baby on the mouth.
Mm-hmm.
They share, even the moms, they check to see if the food is too hot before putting that spoon. So you're saying that it's not all genetics, but it is still from the parents mostly transferring that bacteria to their kid's mouth. It's familial.
Yeah. And so in the maternal microbiome is actually a transferred thing, because when you're in your mom's womb, if she had the wrong kind of microbes growing in her mouth, we know they make their way into the placenta to coat the baby.
Correct.
They're there. So that, you kind of were developing around and with the microbes from your mom.
So is it important before getting pregnant or during pregnancy to have the best microbiome ever?
Absolutely.
'Cause you're literally going to affect your baby's life forever and ever.
Forever and ever. Salivary test, everybody wanting to get pregnant.
Let's talk about that, salivary testing.
Yeah.
I think it should be a standard of care. It's crazy to me that you go to a dentist and you don't have your saliva checked. I think it is completely below the standard of care,
Mm-hmm.
not evaluating the actual microbiome. It's like going to the doctor and not getting a blood test.
I know.
Well, you walk into the doctor and say, how do I look? Like, you take a blood test and
I
they
know.
check to see what's going on. How come dentists are not
I don't
checking
know.
the saliva?
Okay, so I'm an outsider to dentistry. However, most diseases of an immunologic nature and dealing with bone, you have to pay attention to molecules in the molecular world and look at immunologic, microbiologic, and metabolic. I mean, A1C is a metabolic marker, right? And it's hugely predictive. In an immune world, in rheumatology, we do panels all the time looking for antibodies against your own tissue or cytokine levels. Some of us are now even looking at microbiome markers. So and with the mouth, it makes so much sense because that's the number one cause of dental problems is the microbe.
Correct.
Yeah.
And you can find biomarkers for actual diseases in the saliva if you can isolate those, right?
Cytokines,
Like
chemokines.
I've heard of, there's a company, Oasis Diagnostics.
Yeah.
And they said, we have biomarkers for Alzheimer's and dementia. We can check your saliva and we can see if you have biomarkers for Alzheimer's and dementia. There's a company called Viome that has biomarkers for cancer. Like, you can actually screen for cancer through your saliva.
Absolutely.
Like,
that world exists.
So dentistry, to me, it seems like it's going to be, it's kind of like a doctor's office. In fact, it's probably the first line of defense. Like, you want to see what's going on, you check the saliva first. As much as you would check the blood, you would want to check the saliva, no?
I think you need to take everybody's baseline in pediatric dentistry and see how it changes over time. Because we do know that, like in rheumatology, there is basically a idiopathic tendencies occur when you're going through hormone changes. So that's, in your adolescence and then also in your 50s and 60s through menopause or male menopause equivalent. That's the only other time your microbiome can unlock and start to shake around.
That's
and
insane.
Change.
That's insane. So okay. So let's get some takeaways here. So I want to talk about your product a little bit and your science. So you've basically developed some prebiotics. They're not even live bacteria. They're just basically like natural substances that will impact the way these bugs metabolize. So from what I understand is you've created some, a combination, a cocktail of things that we've already been using individually. And some of these are like amino acids. Some of them are sugars. I don't know what the cocktail is, or if you feel comfortable sharing this stuff that, by the way, NASA is using in space. Like, that's crazy. So they're taking this stuff as a mint after they eat, and it stops sugar metabolism. Your mints, when you take it, you suck on it, and it stops your bacteria from metabolizing sugar, and by doing so, you stop cavity-causing bacteria from creating acids, and essentially we can potentially stop cavities by having a mint?
Yeah, I mean, it's a fairly easy process. Your tooth demineralizes in the presence of acid. The number one, our mouths are coated with acid factories, and we feed them every time we take a sip of beverage or food source that has, sugar in it. And so we found this naturally produced molecule. It's made by soil bacteria. It's technically called a postbiotic, which means it's made from bacteria that are actually talking to other microbes, but it also talks to candida and fungus too, so which is awesome because candida causes a lot of cavities. And so it's just literally blocking them from bringing in any sugar. And so they're stuffed up, and
you just starve them.
Sugar starve. Yep.
That's amazing.
But it doesn't hurt us. It doesn't affect us.
So we take a mint after we eat.
Yep.
We can't brush and floss. We'll take a mint, and this mint will basically kind of feed the bacteria or stop them from being able to take the food and break it down into acids, and they can't metabolize, so they can't cause harm.
Right. And then we're asking them to be healthier and say, hey, eat this little steak called L-arginine, and here's the vitamin that allows you to do that. And we're giving them these 2 prebiotics.
Okay, so since you mentioned it, I'm going to mention it. So vitamin B6 and L-arginine.
Yeah.
The combination
Simple
is
as that.
simple.
But it's patented.
So it's patented. So kids can take this. Adults can take it. Pregnant patients. Who can take this? This is natural
I built it
stuff.
for my grandmother. Yeah.
Okay.
Dogs, cats.
So we should be having this stuff all day. I mean,
You can.
full disclaimer, I take it all the time.
I take it too.
I take it all the time. I love it. It tastes good. And I just, even dentists don't brush after every meal. So I just pop one of these and I've seen a profound impact. So what does this mean on the future of dentistry? Like what should we expect? Should we give this to our patients? Are we going to have any business left?
You will have business left. Although we have been completely ignored, like at dental conferences, they literally walk around me and avoid me because I think they're afraid. But we're not trying to shut down anybody's dental business. There's ways to work together. I fundamentally believe in public health. So,
okay.
And I don't want people to get gum disease because boy, oh boy, that shortens your lifespan.
Can we put this in water? Like,
yes, we're getting ready to do it.
Like the way they put fluoride, can we put some of this in the water? It's healthy. Like,
absolutely.
So is this going to help our gut as well? Like, does it stop at the mouth or is this like systemic? No,
everything we've learned over the past 13 years is it is a systemic effect. If you really clean up the mouth and grow good, you're going to have downstream genital urinary benefits, gut benefits, skin benefits.
So, okay. So how does this impact like root canals or implants? Because those fail because of bacteria. Can we stop getting so many damn implant failures? Can we stop getting root canal failures? Can this help improve the microbiome within, the socket?
Absolutely. Yeah, because there's microbes there. Just because you're irrigating with a bleach solution.
Right.
In all of our research, in an established biofilm, you can have 50%
it
bleach
reestablishes some
for
biofilm.
30 minutes incubating something with a established biofilm, and it does. You can still cultivate living microbes from it. They are that durable. It's false assumption that because you're treating with ozone or bleach or whatever, that you're knocking out the microbe. They're there.
My whole education has been a lie.
A lot in medicine is skewed.
So this is incredible. So how do we get this stuff? And is it ready? Is it still in research phase? Like, is it safe? Like, how do we get our hands on this? How do we give it to our patients? What are you doing with it now?
Yeah. So it's been now through the gauntlet of multiple clinical studies and it's shown to be efficacious. And it's already been deemed safe by the FDA and the European Union. Yeah. So now we're in production phase. So we've got
this stuff, right?
Yep, that's that stuff that I built for my grandmother.
So what do? We just take it every day?
Take it every day?
Like after I eat, after I brush? Like
definitely before you go to bed.
Okay.
Because when you're sleeping, those microbes are literally pooping in your mouth all night long.
Oh, that's nice.
Yeah, it's gross. But yeah, that's true. It's true.
So is that why you wake up with morning breath?
Mm-hmm.
Okay.
Mm-hmm. So this will cut down on that too.
So does it stop biofilm formation? Because if they can't eat and create biofilm, or does the biofilm just change?
The biofilm changes. So instead of making it out of sugar, which is highly cariogenic, they instead make it out of protein and, get this, DNA and RNA.
That tastes really good.
Yeah.
That tastes really good. What flavors do you have?
Well, we have mint and we have orange and we're coming out with lemon.
Can you put this in Gushers?
I bet you could.
Can we put this in Red Bull and like Coca-Cola?
We are working on, getting it into energy drinks. We do know that if there's sugar present, even if there's these magic ingredients present in a sugary beverage, the microbes actually are blocked.
Really?
Yeah. It's pretty cool. And it can be put in food. Go through the baking process.
How about my dog? Like, can I give this to my dog?
We have a dog product called Teef. Yeah.
Teef.
Like those teefers.
Teef?
Teef.
Teef.
You got it. Yep.
Okay.
Apparently it means...
I give mints to my dog? How does that work?
No, it's just the water additive. But we're coming out with a treat pretty soon.
You put it inside the water and...
Yeah, they just drink it.
They don't get cavities.
Very few dogs get cavities, but they do get...
That better breath?
Gum disease rampant,
Can I kiss my dog now? After this?
After a couple doses. It takes some of their mouths are pretty heinous.
This is incredible. I'm just I'm dumbfounded at, so where's dentistry gonna go, and like what's dentistry gonna look like in your eyes, or NASA's eyes, or I don't know who's looking at this stuff. Like, where is dentistry gonna be in 5 years?
I think it's gonna, that's a really good question, but I do think it will follow the path that dermatology has gone.
Which is what?
More on the aesthetic side, more on the
Okay.
building
Veneers
pretty
and-
smiles,
yeah.
building beauty.
Okay.
That's more lucrative. This stuff is just, basic prevention and treatment.
I think of all the medical missions I've been on in remote areas, and I don't know, everywhere, Guatemala and Honduras and Belize, and like, imagine giving this to the kids early on. We can decrease the burden that we're putting not only on them, their families. Like these, I've treated 12-year-olds who have like 2 teeth left. 13,
Oh gosh,
you know what I mean? They're just it's just
that's sad.
they don't have access to sometimes toothpaste and toothbrushes. Like in some of these remote areas, they're surviving. So can you just put this in their water?
Yeah, that'd be great.
That's incredible. Well, I think we started this show out with a banger. The can we call you the woman who will the scientist who will eradicate cavities? Well, I'm excited to see where this goes, and I hope we can have you on the show again very soon. And how do people get this stuff? Like, or how do they reach you? Do you have an email? Where do we find this mad scientist?
Yeah. They can just email me at Emily.Stein, Stein, at primaltx.com, which is P as in Paul, RIM as in Mary, AL, T as in Tom, X as in X-ray.com.
You had to make it difficult.
I know. I overcomplicate stuff.
So like, are you public, or like, can we invest in this? Like,
Yeah.
this sounds like it's gonna.
We're private.
You're private.
Private
Okay.
for a reason.
Okay. So like, can we invest in the company? I know
Sure.
you still haven't hit the stock market. Are you going to go to the stock market? Are people going to be able to buy stocks?
Maybe
in this?
eventually, yeah. Maybe eventually.
What's your goal? Like, what's your vision?
We want this to be in everybody's mouth worldwide because it is so important. So important. We won't have most of these awful diseases that originate in the mouth if we can get this in people's mouths throughout the day.
That's incredible. Can dentists like buy this and give it to their patients, or what do they do?
Sure. They can just email.
Just email
me.
Emily.Stein at primaltx.com.
Yep.
Okay.
Yep. Or go to our Primal Health website, primalhealthllc.com.
Okay. Well, we'll flash this. We'll flash the link to this. But thank you so much for coming here. It's been incredible knowing you. I'm so excited about the potential impact you're going to have. Not just on our oral health, but on systemic health, on cancer, Alzheimer's.
Yeah.
We didn't even get into Alzheimer's and dementia. We'll have to have.
Scary
We'll
stuff.
do another one on Alzheimer's dementia because it's probably my worst fear.
Yeah. Yeah.
I can handle everything else, but if
losing your mind,
losing my mind, I can't handle that.
I know.
Yeah. That's a tough one. So I can we'll have you back on. You promise to fly back out.
Sure.
And we'll do another one. But thank you.
Thank
you so much. And guys, thank you for joining us. What an exciting first show on the Dental Reset, and this is the caliber of people you should be expecting from the show, and really looking forward to adding many, many more of these podcasts. So thank you for joining us, and have a wonderful day.